Professor, put this into perspective. When you have countries on a rolling basis suspending the shots, what does that do to the psychology around eventually getting the shot?
This is a very good question, because on the one hand, we want to try and make sure that people do have confidence that is appropriately placed in the vaccine, and the regulators are being very cautious, and they are clearly, on the one hand, that could reassure people that they are being extremely cautious and extremely careful, but on the other hand, it could undermine confidence in the vaccine. And this is a vaccine that has already suffered from a lack of confidence for a number of reasons already. So I think I've got a degree of anxiety about this, about whether they're getting the balance quite right.
Mm-hmm. In terms of what you would expect with such a rollout, millions of these doses have already been administered. Certainly here in the UK, a lot of people have already had the Astra shot, including myself. I should probably say that at this point. What kind of case numbers would you... What I'm trying to understand is this a background effect that you would normally expect, which is Astra's arguments, in terms of if you have this number of people getting the shot, at some point you are going to get a background effect where you do get people with DVTs, you do get instances of thrombosis. Is this background, or is this, how easy is it to prove a link to the shot?
It's very difficult to prove a link to the shot at this level of thrombosis. Essentially, people are getting thromboses all the time for all sorts of reasons. And we would expect, typically, given the background rate, to be getting about 100 cases every week in a group of 5 million people who've been vaccinated. So getting numbers like 30 cases, 40 cases, something like that, would be well within what you would expect if they hadn't had the vaccine. And I'm sure there are other cases that are not being recorded, but even so, it doesn't give you serious grounds for concern. But on the other hand, we do know that people are going to be very vigilant whenever a new vaccine is introduced, and we need to follow them up and make sure we're not missing others, for example.
How long do these now tests take?
Well, I think what we're going to see is an intensification of looking for any other cases that maybe haven't been recorded. But even if we did, it would still need to be quite a lot more to, I think, give us cause for concern. The other thing is that it's not obvious what the mechanism would be for this to happen. We also do know that the risk of thrombosis is much higher, very high, in people who have COVID. So therefore, you're reducing the risk anyway, simply by preventing people from getting the disease. But it is really difficult just to see a link. And just because something happens after something else, we know that that doesn't necessarily mean that they're connected. But it is right to be vigilant.
In terms of the cohorts that are being vaccinated as well, at the moment in Europe, it is still the older demographic that is being vaccinated. Does that again change the background to what we need to look at here? I'm assuming that you get higher levels of thromboses, DVTs, etc., in that older cohort.
Yeah, absolutely. The rate of thrombosis in the population goes up quite markedly with age. So these are exactly the sort of people that would be getting them anyway without the vaccine. And, that's another reason why I think when people like myself are looking at it and thinking, yes, we need to find out exactly what's happening, but not being particularly alarmed about it.
So, Professor, how does this then shape Europe up for the herd immunity forecasts, considering the psychological effect now around the Astra vaccine?
I think that's really worrying, because we actually need to get a very high level of herd immunity, particularly with the new variants of the virus that are more transmissible. And that actually increases the herd immunity threshold up to 85, 90%. Even as it is, we're still only vaccinating adults, and we haven't got down the age range yet, but we're going to have to move to vaccinating children to get to that level. And more than that, and I think really importantly going forward, we're going to have to look at those groups in populations who are less likely to be vaccinated. That means people living in disadvantaged areas, people from minority ethnic populations who have been disadvantaged by the virus already, and maybe doubly disadvantaged by not having access to the vaccine. But it will be crucial for our societies that as many people as possible are vaccinated.
Do you think this will further push the world towards RNA vaccines? Is the adenovirus approach becoming more dated? Do you think, because it does seem as if we have seen the RNA vaccines being rolled out more smoothly, that in future people will kind of be directed down that route rather than the traditional route?
Yeah, that's really difficult to say because, in fact, both have advantages, both have disadvantages. Well, both have got advantages, but they're slightly different. And I think it's going to be a little while before we're really sure about what the long-term impacts on immunity of the different types are. So possibly with both of them, in fact, now you can re-engineer both of them relatively quickly, so that's good. But I think certainly the addition of RNA vaccines to our armamentarium is a major step forward, and I think could also bring other diseases into the scope of vaccination that we haven't so far.